So when we say to our addicted patients, you don't have to remain addicted to anything. You can substitute a behavior, such as working,
and retrain your brain to be
working a 12-step program,
right.
going regularly to meetings of Narcotics Anonymous or whatever, and you will train your brain to take over your life in a more constructive way.
Exactly.
You see, I find that such a message of hope, because the alternative is the standard approach, which is to say that addicts have to have maintenance. They have to have drug maintenance.
Right.
Methadone or diazepam or Prozac, or they've got to have some form of maintenance, and I don't believe that. We've had 4,000 patients.
Well, the 12-step program for quite a long time is very standing evidence that's not the case. I mean,
but you've got to look at it.
Right.
People have opinions about 12-step programs without having been to a meeting. They have all sorts of prejudices. I suppose, again, I think it was Professor Lawrence Weed who created the promis philosophy. He was Professor of Medicine and Community Medicine at the University of Vermont. And he said to me, universities exist to prevent the spread of human knowledge.
But as you say, we don't want to get too adversarial.
No, indeed.
It's easy to do, though, I must say.
And my hope is to be able to show that the ideas that we've got at Promis are, in fact, inclusive of lots of other ideas. I want to learn more about motivation enhancement. I want to learn more about NLP. There's lots of things I want to learn more about. Whereas in med school, I was taught prescribe, prescribe, prescribe. And
well, that culture is slowly changing. I think it's partly, yes, I do, because I think it's partly, number one, a grassroots movement, where on the consumer side, people know that this has gotten out of hand. Let's just say it that way. And then the other side is that this neuroplasticity work it's mainstream work. So it's not.
How did you do that so quickly?
Well, what I did actually was study obsessive compulsive disorder, but in the book, what I did is just do a massive literature search, and a lot. It's absolutely true that there was a lot of data there that the researchers themselves had not really realized had the theoretical significance. 20 years ago, when we started doing these studies, and it's just over 20 years now, that was the accepted dogma, that these patients are not treatable. And of course, there's been literally a revolution in showing that they're eminently treatable. My approach to it has taken advantage of this attention-focusing skill, and especially the specific kind of attention that's called mindful awareness, or the impartial spectator perspective, which allows a person to look within themselves and use the awareness of their inner process within a rational perspective to make altered decisions about how to act in the face of urges and thoughts that they come to view as just their brain sending them, and not identify with them and not become, as it were, too attached.
It sounds to me as if your aim is to help them to be more functional.
Well, more functional, and definitely more functional, but more functional within a frame of having additional awareness of the reality of their circumstances.
And therefore peace of mind.
And
if you can do that for someone who's got an obsessive compulsive disorder, that is a result.
Right. And it obviously has a lot of analogy to substance abuse problems.
Yes.
It has a lot of analogy.
You see, again, as far as the substance abuse work that we do, I am not interested in simply getting somebody abstinent. I don't drink.
Right.
Well, okay, so you don't drink.
Right.
But anybody want to live with you?
Right.
You know, that's the dry drunk.
That's the dry drunk.
Whereas, what I'm looking for our patients, peace of mind in spite of unsolved problems, happy, mutually fulfilling relationships. It's just not what I think about my wife, it's what she thinks about me. Spontaneity, creativity, enthusiasm. That's recovery. That's quality of life.
Right.
That's what I'm looking for. I'm not bothered about whether the person's got a job. What sort of a job? Is it something he would be really capable of doing on his best day? I think sometimes people's expectations are so low. A man's reach should exceed his grasp.
Well, what is that?
We should always be looking forward.
I mean, yes, I certainly agree. But I do want one thing though, in the obsessive compulsive disorder case, I actually consider essentially all work to be therapeutic, at least for obsessive compulsive disorder. So, I mean, the notion, I mean, if a person is actually utilizing their employment as a means of enabling themselves, one can always go up the ladder.
Yep.
I mean, so I do have a concern about people feeling that some job is too beneath them, or saying they prefer to be on disability than do such and such a job.
It's a dependency culture.
There is, right, that is a dependency culture. And the fact is that work itself is empowering, and work is very honorable.
I think that one of the prime functions for people like you and me working with clinical patients is to inspire, to encourage,
it's about
to give them a sense of hope.
There's no question about that. Inspiration. I mean, I have a saying that is, being a therapist has a lot in common with being a football coach.
Absolutely.
You actually have to get in there and get your people on the ball, and
we have our sports facilities here, so that people can go and kick a ball around. People often imagine that all you've got to do with addiction is to have some healthy pursuits, get a good job, get some exercise, and so on. It's not true. Those things are part of the product of getting.
But they're also part of the process. You see, they're not ends in themselves. What they are is
part of the process.
They're means to attention focusing and awareness. And see, that's really it in a nutshell. It's really, this whole notion of awareness is really awareness of what are you attending to and how are you processing what you're attending to.
Right.
And when you're in a difficult situation as a person with obsessive compulsive disorder or acute substance abuse recovery, most assuredly is, just having the sense that there are other things that you can engage your attention in is very empowering. Very, very empowering. So that's the heart of the empowerment that we're looking to instill in.
It seems to me that you're saying two things. First of all, you can get better. You can change.
Yes, absolutely.
This is not a sentence.
And we've demonstrated that as you do, you will be changing the brain's response to the environment systematically.
The other thing you're saying is that you have the power within yourself, when it's correctly harnessed,
that's absolutely
to be able to do that.
The primary focus of treatment is inward.
Yeah.
And what outward treatments are done should be done as a way of enabling the inner treatment.
So again,
it's an empowerment process.
You're encouraging us to work with our patients.
Absolutely.
Not on them.
It's an empowerment process.
What a lovely thing. I'm very grateful to you for coming here.
It's an honor, sir.
Thank you for sharing.
Very much appreciate the opportunity to
speak
speak with you today. Thank you.